During the pandemic, I worked with a team of researchers to study a couple different industries. So the most important one probably was nursing homes, which was the epicenter of the virus for the first year and a half. If you had a union in your nursing home, residents there were about 10% less likely to die of COVID than if there was no union. Workers were about 8% less likely to be infected by the virus if they had a union. And partially, in other words, like those are real material things, like we're talking fewer deaths. So in other words, if you extrapolate those numbers out and imagine the entire industry being unionized, that saves about 8,000 excess deaths. And all those people have family, friends, and loved ones whose that effect ripples out to. The reason was to some extent simple, like workers have a voice on the job, and workers can, they have better access to PPE. Like throughout the pandemic, unionized workers have better access to masks and gloves and eye shields and gowns. I talked to nursing home workers who were using like umbrellas and old raincoats, like for PPE without a union. That stuff was not common when you had protection. So nursing home workers, went on strike, did walkouts, held protests, and those things, build up your power, build up your voice on the job, and it makes a big difference.
And so it's no shock that in terms of where labor stood, from an organizing perspective, it was let's take COVID seriously as opposed to the management or the boss position of getting back to normal.
Yes, exactly. Like, unions had a real incentive to do right by their members in a lot of ways, because if you're a low wage healthcare worker, like I interviewed tons of nursing home aides, and their wages were so low that they would have to work at 2 or 3 different nursing homes to make a living. What that meant during the pandemic was that you spread COVID, right, like among the very patients that you were helping to keep alive. And everyone said this. Everyone's like, I know, like that I am contributing to this virus spreading, and yet I'm the only one here that can save us, to some extent. And if you make $3 or $4 more an hour, that actually translates into, well, maybe I don't have to work 2 jobs, right? Like those kind of things make, if I have employer-paid health insurance, I don't have to work longer hours just to get health insurance, which means like, I can have break times, I can have rest times, I can sleep better, I can take care of myself. And really, a major theme throughout the book is the working conditions of essential workers are the living conditions of the rest of us. Like, we're all better off if we're all better off. And we want those people, working nursing home jobs to make $30 an hour and to have like full, like nursing aides were excluded from the CARES Act, like protections under the CARES Act. Like we relied on them to save people, and then we left them to die. And it's really, it's a shocking fact about how we treat the people at the bottom. So you can consider the working class people as either the bottom or a foundation of democracy. And those are 2 very different things. They sort of sound like the same word, but they're very different.
Yes. And before I let you go, I wanted to talk to you about the discussion about a worker shortage that we're experiencing right now in the U.S. What's your take on how that has been framed by governmental officials, elected officials, media, etc., in contrast to the reality of what it actually means?
We just have a surplus of bad jobs. That's basically what the American economy is. Like, for the last 20 years, we have hollowed out middle-paying, decent jobs. And we've added far more jobs at the bottom of the income ladder. And as jobs have gotten worse, like healthcare protections have gotten worse. And as healthcare protections have gotten worse, like people's safety have gotten worse. Like, it's really like, I don't know what the metaphor is, a dominoes thing or something. And so we have a surplus of bad jobs. During the pandemic, during the height of the pandemic, the labor shortage was actually not that confusing. Like the census asks everyone, why weren't you working last week? And you can just read that data. And it says that people were caring for loved ones or themselves or children who were sick with COVID. That's basically what happened for 18 months. And we still have a crisis of care. Like daycare centers closed and never reopened. Childcare providers shut down. Like there's still millions of families who can't work because they can't find care for their kids, elderly, what have you. People took families out of nursing homes and are caring for them more by themselves now because those places were so dangerous. So I think we're still seeing like the care crisis as driving to some extent the labor shortage. The other thing is that people. That's one explanation. The other one really is that people did become just completely fed up with dead end work. Granted, tons of people are still doing it, but I think there are fewer and fewer people who are looking for it. And some industries that basically have bad jobs, like restaurants are not coming back the way they were 4 years ago. We're not going to have as many, and we just have to live with that fact because the jobs. Working in the kitchen or the front of the house at most restaurants is a pretty demeaning and demoralizing $2.35 an hour job. And we should have less of them. And I think a large amount of people are beginning to realize that.
I mean, and it is you can also trace that back to outsourcing, globalization, the United States
Fishing, right.
becoming a service economy largely. And so it just takes one shock, like the coronavirus pandemic, for that house of cards to begin to
Right.
tip over.
Right. Well, American employers are like addicted to low-wage service jobs, and we have to break that addiction. Like, there's nothing inherently bad about service work. We think of those like menial, minimum wage, sort of cashier type, jobs as being inherently bad. We once thought about that about the industrial working class jobs, which bloomed the middle class in the middle of the 20th century. Those jobs were made better. They were made better by organizing and policy and unions. And service sector jobs can be good too.